Hey Wellness Warriors, welcome to the Wellness Revolution. I'm your host, Dr. Milan Reobe. In this week's episode, we're talking about the hidden faces of burnout that keep you trapped. And so what do I mean by that? As a board-certified medical doctor with special areas of expertise in integrative and holistic medicine as well as Eastern medicine, I've seen a lot of burnout in my career. And I experienced burnout going through my career. And so this podcast is heavily focused on burnout, but the thing to remember always is that the things that cause burnout are not always what they seem to be. And again, we have definitions of burnout that relate it to the workplace, and many experts now, including me, are beginning to really stress the point that no, this is not a workplace situation. Now, that doesn't mean that the workplace is not contributing to the burnout or perhaps even unmasking the burnout. But the thing is that the burnout starts within us and we carry it around with us. So when we go to work, when we go anywhere, when we go to even on vacation sometimes, we'll take our burnout with us, right? We're a little cranky, we're a little tired, and we don't feel recovered even when we come back, and then we need a vacation from our vacation, right? So those are some of the very subtle signs of burnout. But what happens with burnout is that it tends to go with other conditions. It tends to have common causes as other conditions. And so if burnout isn't a workplace situation, then what is it, right? So burnout is essentially anything that lowers or obstructs your metabolism to the point where you're feeling tired, and an appropriate amount of rest doesn't seem to do the trick. Even when you eat well or you exercise, you're still tired, or you still have brain fog, or you're still, a little bit uneasy, not feeling, quite yourself. And this is burnout. And metabolism, again, is essentially how we make and use our body's energy. And if we're not making enough energy, or if that energy is being obstructed by things like inflammation, heavy metals, and other toxins, then we are at risk for burnout. The thing about that to remember is that those are very commonly causes of other diseases that people get diagnosed with instead of a burnout diagnosis. And not that we shouldn't diagnose those diseases, they're very important to diagnose, but the thing about them is if we only treat them in a vacuum and we don't take into consideration the coexisting burnout, then the treatments are incomplete. And so this is what I mean by the hidden faces of burnout. Probably the most common hidden face of burnout that I've seen throughout my career is depression. And so people will come in and they're already on their antidepressants, but they're still not feeling well. So while they may not feel quite as depressed or even anxious at times on the medication, they're still tired, they still have brain fog, or they're gaining weight from the medication and having side effects. And so very often they come to me looking for a solution to help them get off the medication because the medication is causing more side effects than the original condition at times. Now, of course, we always recommend that they do not stop their medications, right? I tell all of my patients, please don't ever stop your medications without proper guidance. Our goal is to figure out, why do you have the depression? Aside from, of course, what we already know is a major factor, right? The mental and emotional factors. There are also physiological factors. So when someone comes to me as an integrative medical doctor, well, I'm not going to be their therapist or their psychiatrist. I am going to be their body specialist, so to speak, and look for the internal, physiological causes that coexist with their depression so that they feel better and they don't have depression anymore, right? So while they're getting their talk therapy or their cognitive behavioral therapy or they're on their medications, whatever their treatment plan is, I complement that by looking at the physiological things going on in the body. Those same things are what cause burnout. So when someone comes to me with depression, for example, I had a 23-year-old young lady come to me. She had been on antidepressants for over 5 years. She relates that she was in college at the time when she just started going down this slippery slope. The pressure of her classes and being away from home, all of those things were really weighing on her mind, and the exams she had to take, the amount of time she had to study. and trying to socialize and make new friends, right? Because she was in a completely different environment. And then, of course, she was, she wanted to go out and socialize. And so she was drinking and having a good time. And she started to really feel poorly. She first started feeling tired. Like she would wake up, and no matter how many hours of sleep she would get, she wouldn't feel rested, right? And then she felt unmotivated and sad all the time, especially around her menstrual cycles. When she got her period, it was even worse. And so then she went to see her primary care physician, who put her on an antidepressant and referred her to therapy. And so she was engaged in talk therapy. She was still on the antidepressant when she came to see me 5 years later at the age of 23. She was relating that, yes, she wasn't slipping down into the depths of depression, and she felt a bit more stable when her menstrual cycles began, but she was exhausted. She still had the brain fog. She still felt like she really struggled through college, and now she was starting a brand new career, which was very demanding, and she was feeling like she was starting to spiral down again despite being on her medications and also having had some medication adjustments. And so she was really concerned that something was missing. And so what was happening in her case is that she had a cold deficient dynamic metabolic type, and this was causing her burnout, which was also causing her to feel more depressed. And so, yes, depression is definitely a mental and emotional condition. However, it has physiological impacts that if we don't address them, people stay trapped. So she was in a burnout state, and that's what led to the depression. And so the depression was treated with an antidepressant, but unfortunately, antidepressants don't treat the underlying causes of the depression. And so it was a bit of an incomplete treatment. And so she was kind of trapped in that diagnosis until she, by her own suspicions, came to get additional help. And so as we helped her to treat the cold deficient dynamic metabolic type, her body temperature started to come up. That meant that her metabolism was able to run more efficiently. And we also found out what nutrients she was missing, why she was missing those nutrients. We corrected her nutrition, asked her to eat small, frequent meals, avoid things that would make her colder. As you remember from our last podcast, if you're too cold, you need to warm yourself up. So we asked her to eat things that were well cooked, spicy, small, frequent meals, because she was a deficient dynamic metabolic type, right? So we asked her to make sure she wasn't fasting, make sure she was eating her breakfast. As a biological female, we asked her to get 9 hours of sleep instead of 8, which was probably her biggest challenge, with her busy lifestyle. Making sure she was going down on time was a more challenging situation for her. She was able to get the nutrition going and her exercises. She was able to kind of scale back and do things that were more restorative. But the sleep, that's usually with my younger clients, that tends to be what holds them back, is making sure they get that sleep. But she did do it, most nights, and that was good enough, right? So she was able to reverse the cold deficient dynamic metabolic type, and she felt much, much better. And so she was able to reduce the doses of her antidepressants under the care and guidance of her psychiatrist. And so we're still, kind of working on things, and hopefully we can get her off of those meds. But, she had just come in a few months ago, and so, we're getting her very slowly down and off of her medication, because once you've been on antidepressants for a while, it's not that they're addictive, but the way that they change the body's physiology, it's very difficult to just stop them. And so you have to really kind of go with the body, go with the flow, and very slowly wean down and off those medications so that you don't have withdrawal effects. And so depression, probably the most common hidden face of burnout that keeps people trapped. And so that leads me to the second most common hidden face of burnout, anxiety. And so anxiety is a very, very common condition that unfortunately plagues millions and millions of Americans and people increasingly throughout the world. And anxiety is, generally speaking, like this feeling of angst, a feeling that you just can't quite relax. Some people have difficulty sleeping. Some people have difficulty focusing. And of course, it's a major problem, very often treated with antidepressants, sometimes anxiety medications. And again, the antidepressants and the anxiety medications are not treating the root cause of the anxiety. And so therefore it's a hidden face of burnout, because very often, again, the anxiety shares very common causes with the burnout. And so they're kind of running side by side. And so if you don't treat them both, you have an incomplete, treatment. And very often if you treat the burnout side, you automatically treat the anxiety side, and those people don't need to be on anxiety medications or antidepressants. And so I've seen that quite a bit in my practice as well. The most striking example was a young lady, again, now that I'm in New York, I'm saying young lady a lot more. But she was, I have to remember, I think 32 or 33. And she came in, again, on antidepressants. She had a long-standing history of anxiety. Started just after college, where she started her new career in marketing. And so a lot of stress, high-pressure situation, many hours. She also traveled quite a bit. So she was changing time zones and, just really feeling all the different layers of stress that a new career like this would cause. And so she ended up on an antidepressant after seeing her primary care physician for the inability to sleep, and she was having panic attacks. Sometimes when she was flying in the middle of a flight, she would be sick, or sometimes just, random times of the day. And, of course, being new in her career, that made her even more anxious, because she was concerned that it might impact her work performance, or that her colleagues might notice that she was not doing well. And so she started on her antidepressant, and she felt a little bit better, but she was still struggling to sleep. She was still struggling to really actually feel relaxed and confident in herself. And so when she came to see me, she was still on her antidepressant, had tried several different supplements, several over-the-counter, remedies that she thought would help. She had been seeing an acupuncturist as well when she came to see me. It was helping some, but again, it was a little bit just incomplete. It wasn't quite getting down to, help her relax as much as she felt that she needed to, and also to feel like she was getting restful night's sleep. And so for her, what we determined is she was a hot deficient dynamic metabolic type. And so what that meant is that she had acidity in her body. So acid is hot, and it causes people to feel warm. So part of the reason she wasn't sleeping well was she was having mind racing, and then occasionally night sweats, especially, again, around her menstrual cycle. Many symptoms are unmasked during women's menstrual cycles. And so she was having occasional night sweats, nothing major, but it was more the mind racing that was keeping her from going to sleep, falling asleep. And the same thing during the day. Like, she found it difficult to concentrate, difficult to stay focused, and she just always had this angst about her. No matter what she tried to do, struggled to meditate. Like, she couldn't quite sit still long enough. She exercised, and that helped temporarily, but then she would slip back into it as soon as she stopped, her exercises, or if she skipped a few days, she just didn't feel well again. And so for her, we needed to cool her down, right? And we needed to build her up. So again, she was having acidity from the stress. Stress kind of causes friction in the body, and we can see that in terms of liver stagnation in traditional Chinese medicine. The stagnation of the flow of energy that's induced by stress will create, kind of a friction and heat. In mainstream medicine, we see this as, poor liver detoxification and a buildup of acidity. And so this is what was happening to her, except that she was also deficient at the same time. And so what was happening again is that she was missing several nutrients, and in her case, a couple of hormones. So when we did her testing, we noted that she was deficient in progesterone, which is used to make cortisol, the chronic stress hormone. So as she was experiencing the stress, her progesterone was kind of being siphoned off to be turned into cortisol so that she could power through the stress. But what was happening is she was also deficient in DHEA. DHEA is an adrenal hormone, and it is kind of the balancer of cortisol. So whatever cortisol does, DHEA undoes. And so cortisol handles stress in the body if it's going on for any extended period of time. So any stress that's going on for more than like a couple of minutes, you're going to start making cortisol as the main stress hormone. And cortisol raises blood pressure, it raises your heart rate, it raises blood sugar, it makes you more alert. And DHEA literally kind of does the opposite. And so DHEA will bring your blood pressure back to normal. It'll bring your blood sugar back to normal. It'll bring your heart rate back to normal, and it will ground you and make you feel calm, once the stress is gone, right? The stressor is resolved. And so she was deficient in this particular hormone. And so this is what was giving her this feeling of angst all the time. She didn't have anything to ground her. So DHA is kind of like the roots of a tree, keeps you grounded, and it nourishes as well. And so she was missing also several vitamins and minerals. So when we did some testing for her, we noted that she had quite a few vitamin and mineral deficiencies. We ended up doing some gastrointestinal testing for her. Also noted that she had an infection in her small intestine called SIBO. And so she needed to have, a little bit more extensive treatment to get rid of the SIBO, make sure that we restored the gastrointestinal system back to normal. And while we were in the middle of doing that, we were also supporting her digestion and absorption with some digestive enzymes and providing her with the supplements that were missing. And so that's how she was able to get the burnout situation completely resolved, and also, start to decrease her doses of her antidepressant as well. And so it's unfortunate that we don't recognize that there are other causes of anxiety, physiologically, that are leading to the other cluster of symptoms that people have. And so when we mask it with an antidepressant, we're still allowing the process to go on, right? So the antidepressant was not correcting the DHEA and the progesterone. It wasn't correcting the infection that she had. It wasn't correcting the vitamin and mineral deficiencies. But unfortunately, we're not trained as medical doctors to look for those things. So it's only with additional training that we learn, like, hey, we need to look at these other things that are coexisting with the anxiety. And in fact, if we look for those roots, those are also the roots of the anxiety. And so this is what makes anxiety a hidden face of burnout, is because it shares common causes on a physical level with burnout. And again, both burnout and anxiety have mental and emotional components to them as well. But if that's all that we're looking at and that's all that we're treating, and we're not bringing the body, along for the ride, we're going to get these incomplete treatments. And so, again, another hidden face of burnout. The other really important hidden face of burnout that I wanted to bring up today is autoimmune conditions. And women constitute 80% of people that have autoimmune conditions. So only 20% of autoimmune conditions impact men. And so the whopping difference in gender is due to our biology as women. So in Chinese medicine, we learn that women are of blood and men are of qi. And of course, we both have blood and qi, both men and women, but women are of blood more dominantly and men are of qi more dominantly. Just like, as an example, we could say that, men and women have estrogen and men and women have testosterone, but correspondingly, women have relatively more estrogen than men, and correspondingly, men have more testosterone than women. It's kind of, that type of an analogy. And so stress consumes blood, and women menstruate. So we are of blood because we use our blood for many of our biological functions. And so we menstruate once a month, we can potentially get pregnant, and we can choose then to breastfeed. All of these things require blood. And, menstruation once a month is actually more of a modern day phenomenon. We're not actually supposed to menstruate once a month if you really actually think about it. So again, if we just go back 200 years, we barely menstruated as women because we were too busy having babies and breastfeeding these babies. And so on average, about 200 years ago, women had 7 to 8 babies. And so there was very little time to menstruate in between all of that. And we had to breastfeed for years because there was no formula. So there was no birth control, no formula. You don't really menstruate when you're breastfeeding around the clock. So at least for the first couple years or so that we were breastfeeding, we didn't menstruate. So we weren't losing blood actively once a month. And so, fast forward now, we're menstruating once a month because, yes, we have, birth control options, and we postpone having children. So this all adds up to having menstrual cycles once a month, and most women are running around blood deficient, so our pulse is thinner than it's supposed to be. Many women unfortunately will feel a little bit dizzy, or they have floaters in their vision. And so now what we have is this, kind of background blood deficiency because we're menstruating once a month for potentially years, and we have stress, right? So again, men and women have stress just the same. But because we're running on kind of a lower tank as far as the amount of blood that we're supposed to be able to have access to, the stress impacts us more. And so this is partly what causes depression to be twice as much in women as men, and autoimmune conditions to involve 80%, or what I should say is 80% of autoimmune conditions to be in women. And so how is this a hidden face of burnout, right? So an autoimmune condition is a condition where the immune system kind of goes awry and it starts attacking itself. And so we can identify those things with blood work. We look for antibodies that are formed against parts of our bodies. So for example, the thyroid it can be attacked in an autoimmune condition. We call that autoimmune thyroiditis. So this is where your immune cells literally make antibodies that are going to attack the thyroid or attach to the thyroid and label it as a foreign substance in your body, so that the rest of the immune system can come and get rid of the invader, so to speak. Except that your thyroid is obviously not an invader, right? It's part of you. And so this causes damage to the thyroid, and potentially can cause an overactive thyroid or an underactive thyroid. From the disruption of thyroid antibody production. And so in conditions that would be more severe, such as multiple sclerosis or rheumatoid arthritis, for example, many clients are prescribed biologics so that the immune system is manipulated in such a way that it doesn't attack itself as much anymore, so that we can mitigate the damage that's caused by the autoimmune condition. Now, unfortunately, what that does is it weakens the immune system further. And in the field of integrative medicine and in the field of Chinese medicine, we understand that autoimmune conditions are actually because the immune system is already too weak. There are already deficiencies in the immune system that is leading to it being confused. So the immune system has just one job, and it's to figure out what belongs in my body and what does not belong in my body. And it's very specific and precise in doing so. And so our immune system is extremely complex. Like, we really don't even understand the majority of how the immune system works to this day. We just know that it works pretty flawlessly in most cases. But in the case of an autoimmune condition, there's confusion. It starts to identify parts of itself as foreign, and then it may be recognizing things that it should recognize as foreign as friendly, so to speak, and not going after things it should go after. This we understand mostly is due to deficiency, depletion of the immune system. And so when we do testing on the immune system, we can actually directly look inside of the immune cells and look for up to 31 different nutrients. And very often, people with autoimmune conditions have very low levels of multiple nutrients in their immune cells. And this is what's contributing to this confusion, because the immune cells require nutrients in order to function properly. And so, again, using these biologics helps to prevent further damage, but unfortunately, it's a double-edged sword, and it weakens the immune system even more. And so when clients come to see me with a diagnosis of an autoimmune condition, they're usually still tired. They're usually still experiencing a lot of inflammation. Very often, they're getting a lot of upper respiratory infections. They catch everything that comes by. And they've had COVID 3 and 4 times, for example, or they get the flu every season, or whatever rhinovirus is around, or they feel like they're always battling something. That's pretty typical for clients with autoimmune conditions. And again, this is because it's a hidden face of burnout. And so while yes, they have an autoimmune condition, and that's shown with blood work, the other side of that is that they are in a burnout state very often. And so, again, they can be one of any of the 6 dynamic metabolic types that we talk about. The 2 broad categories being deficient dynamic metabolic type and excess dynamic metabolic type. And then you can either be hot, cold, or temperature neutral. And so that's how you get the 6 dynamic metabolic types. Very often in an autoimmune condition, there's a deficient dynamic metabolic type. It can be cold or hot or temperature neutral. And so again, it's really the idea of I need to boost my immune system, not weaken it. And the challenge on the biologics is that it's artificially being further weakened. And so those clients really kind of have to double down, and make sure that they have all of the other cylinders firing as much as possible in their bodies so that they can kind of overcome the impact of the biologics and then hopefully not need it anymore. That usually takes a while. It takes a few years. But the thing is that if you don't treat the underlying causes of the burnout, you're also not treating the underlying causes of the autoimmune condition. And so again, they share common causes. It's not that one causes the other or vice versa. It's that they share common causes. And so the autoimmune condition is easily diagnosable with blood work. However, burnout, not so much. Like the testing that we have in our mainstream medical models are not designed to find the underlying physiological causes of burnout. And again, mental and emotional, very important to also assess and treat. However, the physiological stuff that is leading to the actual fatigue and the actual brain fog, the inability to focus, the exhaustion, even the weight gain, and the inflammation, the aches and the pains, all of that, the underlying causes of burnout are what are leading to those things. And so as you look at the causes of burnout and you correct them, you're correcting the causes of all those other things at the same time. And so it's not just a matter of fixing the burnout, it's also looking at and correcting underlying causes of other medical conditions and conditions you don't have yet. So the same causes of burnout are also the same causes of chronic conditions that people get later on in life if the causes of burnout are not properly treated. And so you always have to look at the mind, body, and spirit aspect of everything. And so this is kind of what's missing in our burnout conversation right now, except to the extent that we tell people to, quit their jobs or go on extended vacations, take a leave of absence, get more sleep, do more exercise, eat better. Those are all on the surface, really great sounding things, but unfortunately they don't by themselves work unless well, how much sleep do I need and for how long? What kind of food should I eat? Should they be cooked? Should they be raw? How often should I be eating? These are all the things that you need to know to successfully treat the burnout. Should I detox myself? Should I not? If I do detox myself, what should I use? Should I fast? Should I not, right? These are all the things that are answered by knowing your dynamic metabolic type. And so this is why I use it so often in my own personal practice, is because it's such a foundational principle to know that and to apply it to the 4 pillars of wellness. Eat, move, rest, and detox. And so knowing how to address each of those 4 pillars is critical for the resolution of burnout. In addition to, of course, if you are in a toxic environment, get yourself into a safer place. And so make sure, of course, before you leave your job, if it's a toxic place, that you have a strategy in place so that when you land at the next place, you are burnout free, right? You're recovered, you're feeling much better, and you're able to kind of vet it out and make sure that it's a place that you're going to be able to work at for as long as you want. And so that is the 3rd hidden face of burnout that keeps you trapped. This next one is not really a diagnosis of a condition per se. It's more of a vital sign, but it's more and more being treated like a medical condition, and it's called POTS. And it's essentially postural orthostatic hypotension or low blood pressure. So it's a change in your blood pressure when you are laying down and going to a vertical or sitting up position. You'll see a drop in blood pressure. And so we call that orthostatic hypotension in medicine. However, it's becoming so common that it's being labeled now as a syndrome. And it's really not a syndrome. It's a vital sign. It's a sign that you're not getting enough blood to your head to prevent your body from wanting you to go horizontal so that it can perfuse or send blood to the brain. That's a sign that things are missing. You're not able to maintain your blood pressure. And that can be from numerous things. Again, very often they have a deficient dynamic metabolic type. Again, hot, cold, or temperature neutral. But that's the most common dynamic metabolic type, is that it's deficient. There are things missing that you need to keep your blood pressure up. Very often, again, we see adrenal hormones are missing. So what we'll typically see when we do a saliva profile looking at the adrenal system is we'll check for DHEA and we'll check for 4 points of cortisol. The first point being within 30 minutes of getting up, the next one being around noon, the next one around 4 p.m., and then the next one at night. And what we should see is a precipitous rise, a big spike in the cortisol first thing in the morning, and then we'll see it precipitously drop by lunchtime, and then it peters out the rest of the day. And so very often when someone comes in and they have POTS syndrome, or orthostatic hypotension, when we check an adrenal test like this, we see that the cortisol in the morning is, quote unquote, normal, but the DHEA is low. And so what's happening in that client is they've had so much stress for so long that the body can't keep up with making the DHEA anymore, and now it's dropped to below normal. And what's usually happening is that the cortisol isn't really normal. It's just falling through the normal range on its way down to becoming too low. So very often what we see when someone is first experiencing stress, when they're younger and they're kind of just starting to experience the unfortunate wave of chronic stress that we have, we'll see that their cortisol is high all the time. So when we check their 4-point cortisol, it's too high in the morning, it's too high at lunchtime, it's too high in the evening, it's too high at night. That's the typical thing. And then we'll see that their DHA is normal. If stress keeps going like that, just pushing the system too hard over and over again, year after year, what we then see is that the DHEA starts to drop, and then it just keeps dropping until it becomes too low. And again, this is over the course of years. This doesn't happen precipitously, but it just slowly drops to the point where you have way too much cortisol, not enough DHEA. And then for those people, they typically feel fine. They're not feeling dizzy, they're fine. They feel like they can take on the world, no problem. They might feel a little anxious because they don't have the DHEA there to ground them, but they've got enough cortisol, and so they can take on the world. They don't care that they're stressed out, and nothing's going to stop them, right? But as this goes on, it's wearing the body down year after year. They're experiencing this stress, in ways that are not normal. We start to see the cortisol then drop. It doesn't drop as quickly as the DHEA because your body values cortisol more than it values DHEA. You can kind of still be alive if the DHEA is too low, but if your cortisol drops too precipitously, you're going to have some major problems. We see low cortisol in cancer patients. We see low cortisol in clients with severe chronic diseases like diabetes and heart disease, things like that. We can see it, even in the absence of chronic diseases, we can see this low cortisol. But what happens when your cortisol drops and now it's not able to go up as high as it needs to, so you're still under a lot of stress, but now your cortisol is not over spiking anymore. Now it's just going up to like average, but that's not enough for you because you're too stressed out still. So it's an inappropriately normal cortisol. So it's relatively too low for you, is what it's saying. So when you get up, even though your cortisol looks normal on the test, because you're stressed out and you're getting up and you're going, you still don't have enough cortisol to prevent you from feeling dizzy. And so now you're feeling dizzy posturally. Like if I'm laying down and I sit up too fast or I get up too fast, I have to hold on to something, or I feel like I'm going to fall over, right? That's the first sign that your cortisol is not going up as precipitously as you need it to. There's such a thing as an appropriate too high cortisol. If you are super stressed out, you want your cortisol too high because that's appropriate. You want to then reduce the stress. You want to do things that will allow your body not to have to produce that much cortisol because you're mitigating the impact of stress. That's different. So when you meditate, for example, you do breath work, or you get yourself out of the toxic situation that's giving you so much stress, You won't see the big spikes of cortisol that are too high anymore because they're not needed anymore. But when they're still needed and you don't get them, that's when you start to have trouble. And so this is very often what's underlying this POTS syndrome is when we check their cortisol, it's either too low already or it's suspiciously normal when the DHEA itself is too low. And so this is a huge cause of POTS syndrome and a huge cause of burnout. Because again, the low cortisol is causing both of the conditions. It's causing the POTS and it's causing the burnout. Of course, it's not the only thing. Usually nothing really wreaks havoc all by itself. Unfortunately, cortisol has impacts all over the body. And so it could be impacting the gastrointestinal system, the liver. It can be impacting the brain, and so there's no organ that's safe from an adrenal system that's not working properly. And so very often they have other symptoms. They have other things going on, like they may have hormone imbalances because the ovaries or the testes are being imbalanced by the dysregulation or the abnormalities in the adrenal system. And so it's never one thing, but that tends to be like the major thing. And then if there are GI issues on top of that and you're missing vitamins and minerals and things of that nature, then you're going to have even worse symptoms. So that's where you're feeling dizzy all the time. Like I could just be sitting and all of a sudden I feel dizzy, or if I do too much, I can't exercise, I get out of breath. These are the signs that not only are your adrenals not functioning properly, but also you're missing vitamins and minerals and perhaps other types of hormones. The thyroid can be very negatively impacted by a malfunctioning adrenal system. And so it's really important to get those things checked out and to have a very holistic view. But for all intents and purposes, when someone has POTS syndrome, they're usually in a deficiency state of some kind involving the adrenal system and probably the gastrointestinal system. And so it's really important to get both of those systems tested and supported and restored. And that requires, again, getting rid of the major stressors, learning to mitigate the impact of stress, learning breath work, learning meditation, learning to really change how you see stress, change how your body responds to stress. And that's very, very doable. There have been many studies now on HeartMath to show that it helps build resiliency against stress. Many meditation techniques do the same. And so, it's a very doable thing. So if you have POTS syndrome, very likely you are also in a burnout situation for, again, similar reasons as why you have the POTS. And so very often, unfortunately, people are just told they have POTS and then that's it. Like nothing else is really done. And so seeing a holistic medical doctor, an integrative functional medical doctor, Chinese medicine doctor, is really important because you can't really just run around with POTS syndrome because it's just going to get worse and lead to other chronic conditions if it's not treated. And the last hidden face of burnout that I want to talk about today is fatigue or exhaustion. Very often there's a distinction between someone being tired and having burnout. And while they're not exactly the same, they coexist quite a bit. There's almost always some level of burnout in anyone who's tired for any extended periods of time. You might have a rough week and you need extra sleep that weekend, and you just need to kind of be more lazy and hang out and do gentler exercises or something. But you should bounce back by Monday morning, right? If you are feeling like consistently tired, where no matter how much sleep you get, you wake up a little bit out of it, you don't want to get out of bed, you can't quite focus, and you would describe yourself as tired more often than you should be, then that's also a hidden face of burnout, because very similar causes, again, in fact, exactly the same causes we can say. And again, knowing your dynamic metabolic type will help you kind of get out of that vicious circle that fatigue is. And in my opinion, I think fatigue is like a gateway to other chronic diseases. So fatigue is kind of, on the spectrum of burnout when it's more mild, right? And when burnout gets worse and worse over time, we go from fatigue to exhaustion. And when you're in that exhaustion state, you're vulnerable to other diseases, cancer, heart disease, diabetes, potentially Alzheimer's, dementia, autoimmune, all the things we talked about today, depression, anxiety, autoimmune conditions. These are all things that you're susceptible to if you're exhausted. And that's because you're in a burnout state. But if you're fatigued, you're kind of on your way to the burnout state. You're on your way to the chronic conditions. And so if you can fix the fatigue when it's really early by doing, some things that, identifying your dynamic metabolic type, applying them to the 4 pillars so that the fatigue lifts. What you're doing is not only are you helping yourself to feel better, tired sucks. Nobody likes to be tired. So you're going to feel much better. But unknowingly, what you're also doing is you're preventing diseases that come from that fatigue. Fatigue is a sign, again, that your metabolism cannot support your demands, right? Supply-demand mismatch, right? Too much demand, too little supply. And that is fatigue, essentially. So is burnout. It's simply that it's in an exaggerated state. And so fixing fatigue is another really important thing. And of course, you want to make sure you get your blood work done. Make sure you're not anemic. Make sure you don't have a thyroid condition. And the more, obvious things that we can capture with blood work and a basic physical exam. Also, even if you're diagnosed with a thyroid condition or anemia, you still want to look at the 6 dynamic metabolic types, see which one you are, apply them to the 4 pillars of wellness so that it's a more complete treatment supporting you so that you don't slip into a burnout state. I can't count how many clients I have come to my office and they say, yeah, I'm on thyroid medication and I'm still tired. My blood work looks great. All my blood work's fine and I'm still tired. And that's, again, because they're in mild stages of burnout. And so it's a quick fix, thankfully, when they're just a little tired. It's a much quicker fix for them than someone who's in an exhaustion, like severe burnout state. But nonetheless, the treatment's the same, right? It's the same thing. You determine your dynamic metabolic type. You apply the 4 pillars to it. And, that's what gets you out of that fatigue state. And so the takeaway message for today's podcast is, if you've been diagnosed with any of the hidden faces of burnout that I mentioned today, I encourage you to go to our website, awakenwellnessnow.com, take our burnout assessment, and see which of the 6 dynamic metabolic types you are. We give you some quick tips to follow there, depending on your dynamic metabolic type, so that you know how to apply it to the 4 pillars of wellness: eat, move, rest, detox, so that you can start treating the other, hidden elephant in the room, which is burnout, so that you get a more, complete overall feeling of well-being, which is what it's all about. And so I hope you found today's podcast helpful. You're welcome to take a look at our free training that we have on awakenwellnessnow.com and book a call to speak to me to see how I can help you live your best life today. If you enjoyed today's podcast, I ask you to please subscribe and like and share with your friends. Spread the word so that we can help millions of people recover from burnout and live the lives that they deserve. Thanks so much for listening, and until next time, many, many blessings.